You describe what that is in the context of medicine and health.
For us, we see a digital twin. It's really just this virtual replica, and it's a digital representation of a physical entity. So for us, that's going to be the patient or the human, or it could be something like an organ or, just a digital twin of the heart. And then the key piece that makes it different from just a computational model is that it's getting data in a dynamic way from something like wearable sensors. So it's not just, an idealized representation of a person or a heart. It is really tied to that patient. So we want to bring everything together to really kind of drive this idea of a digital twin, and how do we have a replica of the patient that allows us to do things like remote monitoring of the patient. So when you're, at home going about your daily life, can the doctor check in and see, are you likely to have heart failure? Where are you at? And then giving some kind of actionable predictive power that allows the doctors to make, a better informed decision.
When you talk about prediction, oftentimes we hear synonymous with prediction is AI, machine learning. How is AI and machine learning playing a role in the prediction capabilities that are being built in this digital twin of the patient?
That's really exciting, where we're tying in all of the advances you're seeing with AI and coupling that with the computational science and the physics-based modeling that we're using in the center. Like in my lab, we work on the blood flow side of things. So we have 3D simulations showing what your real blood flow state is in, coronary arteries and a geometry derived from a CT scan, where it's a very patient-specific, personalized model. But then it's informing these large-scale AI machine learning-driven predictions. We see the outcome of this as saying, 5 years from now, we're able to proactively identify heart failure, for example, before you ever even exhibit symptoms. So before you have chest pain, before, you would normally call your doctor or go to the hospital, identify 2 or 3 weeks ahead of that, this person is likely going to have heart failure, kind of like a check engine light for the patient of like, you need to go in, you need to get checked out, and let's identify it proactively and let the doctor go in and say something and, take action ahead of time and help that patient.
That is absolutely incredible. And you can think of how many lives you'd save by getting so far ahead of that prediction that heart failure is about to occur in the coming days or weeks. That's amazing. From the standpoint of the center's mission,